Hi, my name is Kate Ostrander. I'm a nurse care coordinator over at Golisano Children's Hospital.
And I'm Teresa Foydo. I'm one of the pediatric surgery nurse practitioners.
And we're here today to talk to you about different types of G-tubes, how to use them, and how to care for them.
The first tube is a MIC-G tube, which is a long tube with an internal balloon. There is a movable silicone bolster that should be tightened to the abdomen to help hold the tube in place. There are also markings along the tube to show the length measurements. There is not a clamp on this type of tube. You will learn how to kink or bend the tube over instead. There are 3 ports or openings at the end of the tube: a small medication port, a larger feeding port, and a white balloon port. The balloon port should not be accessed unless instructed by your healthcare provider. The next type of tube is the low profile or button type tube. These are balloon type tubes. There are 2 different brands, the Mickey button and the AMT Mini 1 button. For this video, we will be spending most of the time demonstrating on the Mickey button. This is the Mickey button, and this is the Mini 1 button. As you can see, the AMT button is slightly smaller, and the balloon is more apple-shaped than the Mickey button. Both have similar balloon ports and removable extension tubing. The extension tubing is interchangeable for both brands. These tubes come in several different sizes and lengths, which is noted on the tube. Your child's specific size will be noted on your education packet and in your discharge instructions. Each day, you will clean your child's G-tube site. First, wash your hands with soap and water or hand sanitizer before touching the G-tube. You will use warm, soapy water on a Q-tip or gauze to clean around the G-tube site once a day. Rinse the area off with clean water after you clean it with the soapy water. Be sure to dry the area well after cleaning with a new gauze. You should then place a dry split gauze under the tube. A button buddy can be used instead 1 week after your child's G-tube surgery if you prefer. Your child may not soak in the bathtub or go swimming for 2 weeks after your child's G-tube surgery. Do not apply ointments or medications to the area unless instructed by your healthcare provider. In order to flush your child's G-tube and give medications, you will need the medication, a syringe, water, and the extension tubing. Be sure to wash your hands first. Then, fill the syringe with the amount of water prescribed by your healthcare provider. In this case, we will use 10 mL or milliliters of water. Attach the extension tubing to the button. In order to attach the tubing, you will need to support the button with one hand while lining up the 2 small black lines with your other hand. Push down the extension tubing while supporting the actual button. Then turn the tubing in the direction of the arrow. Open the cap on the end of the extension tubing and attach the tip of the water-filled syringe. Unclamp the extension tube. Slowly push the water into the tube. If there are no issues flushing the tube, you may repeat the process with the medication. Be sure to clamp the tube between each medication and flushes to prevent leakage of medications or flushes. Flush the tube with water after giving the medication. Be sure to disconnect the extension tubing when it is not in use. You will need to turn the extension tubing the opposite direction of the arrow until the two black lines line up. Again, support the button with one hand as you gently pull the extension tubing out with the other hand. Be sure to plug the button. You will learn the specifics about how to set up your home feeding pump from your vendor that will provide your child's pump and feeding supplies. These are two of the most commonly used home feeding pumps, the Kangaroo Joey and the Infinity. Both pumps are relatively small and portable. They come with a battery and a bag or a backpack. Other equipment you will receive include an IV pole, feeding bags, and what your child is being fed through the tube. For the first 3 months, please use at least 2 different ways to secure your child's G-tube. This will help to lower the chance of the G-tube getting accidentally pulled out. This is very important. In the hospital, we will be using a grip lock and a covering device to secure the G-tube to keep it from accidentally getting pulled out. Your child will leave the hospital with the grip lock and a covering device in place. Some examples of other covering devices are ACE wraps, abdominal binders, onesie, and G-tube belts. It is also important to remember to remove the extension tubing when you are moving your child from one place to another to prevent it from accidentally being pulled out. Your child's tube may have tape or a red cap over the balloon port. This is a reminder not to use the balloon port unless instructed to by your child's healthcare provider.